Hello, and thank you for joining us today as we talk about our lifestyle change programs at the University of Texas Health Science Center at Tyler. We offer multiple services to aid in improving the health of patients and community members in East Texas. By means of education, we focus on creating healthier habits leading to an all-encompassing lifestyle change. Our goal is to improve and expand quality of life by reducing chronic disease health implications, including but not limited to prediabetes, diabetes, high blood pressure, and high cholesterol.
According to the American Heart Association, high blood pressure and cholesterol increases your risk for dangerous health conditions such as heart attack, stroke, chronic heart failure, and kidney disease. High blood pressure is often known as the silent killer because most of the time there are no obvious symptoms. The heart is a multitasking pump. It not only receives blood in two forms, with or without oxygen, but it serves to pump that blood into the lungs to get oxygen, or when it receives blood with oxygen from the lungs, it pushes this blood to the rest of the body through a network of blood vessels. This is a closed system, so the force by which blood travels within this system is considered blood pressure, and the system is built to withstand a range of pressures. However, when the pressure or force within this system is too high, then you are considered to have high blood pressure. Although you cannot control all of your risk factors, you can take steps to prevent or control high blood pressure and its complications.
Did you know about 7 out of every 10 people who have their first heart attack suffer from high blood pressure? And 8 out of every 10 people who have their first stroke suffer from high blood pressure? Checking your blood pressure on a daily basis can help to reveal patterns that determine whether you're making the changes that are working or not. Important lifestyle changes to control your high blood pressure include a low sodium diet, which can mean trading salt for low or no sodium alternatives like herbs and spices, regular physical activity, managing stress, maintaining a healthy weight, taking medication properly, and limiting alcohol and tobacco. As always, it's important to work with your healthcare team to manage your blood pressure. There may not be a cure for high blood pressure, however, taking medication as prescribed in conjunction with making healthy lifestyle changes can enhance your quality of life and reduce risk of heart attack and stroke and other health threats.
You might also be wondering what cholesterol is and what does it do? Like high blood pressure, cholesterol plays an important role in our risk for cardiovascular disease and stroke. The American Heart Association recommends that all adults 20 or older have their cholesterol checked every 4 to 6 years, as long as their risk remains low. Because cholesterol levels are not routinely tested, it is important for you to discuss your cholesterol numbers with your provider. Do you know your numbers? And have you had your cholesterol tested? Cholesterol can join with fats and other substances in your blood to build up the inner walls of your arteries. The arteries can become clogged and narrow, and blood flow is reduced, leading to health complications that we've mentioned earlier.
Some people believe that children don't need to worry about cholesterol. However, according to the American Heart Association, children can have high cholesterol levels just like adults. This is particularly true for children who inherit high cholesterol levels from both parents. These children are at a high risk for premature heart attack or stroke. Just like high blood pressure and cholesterol, prediabetes and type 2 diabetes, which is a condition that causes blood sugar to rise, can also lead to serious medical problems, including cardiovascular disease.
Prediabetes occurs when your blood sugar levels are higher than normal, but not high enough to be diagnosed with type 2 diabetes. The Center for Disease Control and Prevention considers a fasting blood sugar level of 100 to 125 milligrams per deciliter, or an A1C test of 5.7% to 6.4% as prediabetes. Did you know more than 88 million US adults, over a third, have prediabetes? And more than 84% of them don't even know they have it.
The risk of developing type 2 diabetes can be reduced or prevented by making necessary lifestyle changes. This includes losing 5 to 7% of body weight, and adding 150 minutes of exercise per week can cut the risk of developing type 2 diabetes by up to 58% and 71% for people over 60 years old. This can be achieved through different options such as a national diabetes prevention program like the lifestyle change programs at UT Health Science Center. Uncontrolled diabetes can lead to the development of type 2 diabetes, which CDC considers a fasting blood level sugar of 126 milligrams per deciliter or higher, or an A1C test of 6.5% or above. So more than 34 million people in the United States have diabetes, and only 1 in 5 know that they have it.
Having prediabetes is like your check engine light coming on in your car. It is a signal that something is going wrong. Prediabetes means that your pancreas is starting to get sick, but generally it can be reversed before it totally fails and causes full-blown diabetes. If you have been diagnosed with prediabetes, consider this a second chance to prevent engine failure. The pancreas can recover if you lose weight, exercise, and eat healthier. Unhealthy weight and food intake are direct hits to the pancreas that over time cause it to fail. When the pancreas fails, the body can no longer keep sugar levels in the blood in equilibrium, and it builds up all over the body, leading to blindness, kidney failure, heart disease, stroke, nerve damage, and more. Even if you have been diagnosed with either prediabetes or type 2 diabetes, it is never too late to make healthy lifestyle changes in order to improve your quality of life.
Creating healthy lifestyle changes in your life can be the secret to your success. This includes becoming more physically active. Your physical activity doesn't mean you have to join a gym or buy a treadmill. We're talking about walking briskly outdoors, doing housework, mowing the lawn, dancing, swimming, or even riding your bike, playing sports, or incorporating your exercise bands even in the comfort of your own home. Additional benefits of including physical activity in your daily routine include maintaining a healthy weight and even losing weight if needed, feeling happier, sleeping better, improving your memory, and as we discussed earlier, controlling your blood pressure and cholesterol. Lastly, even reducing the risk of cancer recurrence.
As we mentioned before, eating well can be a key in your success improving your quality of life. This includes smart shopping, reading our food labels, planning our meals, and being aware of the menu when eating out. All can be done in moderation. These are small steps, but important steps that will increase healthier lifestyles. By joining programs like the Diabetes Prevention Program at UT Health Science Center, you will learn these important skills in order to maintain a healthy lifestyle. According to a study from Harvard School of Public Health, eating healthier foods costs about $1.50 more per day, which is about $550 per year.
Eating healthier foods does cost more if broken down by day. However, the cost of not eating nutritious foods proves to be a much higher cost. The Utah State University Nutrition Department discovered eating unhealthy foods leads to consuming higher amounts of sugar, saturated fat, sodium, and calories, which are all linked to higher rates of chronic disease, such as being overweight, obesity, heart disease, high blood pressure, and type 2 diabetes, among many others. Therefore, eating healthy, nutritious foods reduces the risk of chronic disease, making the financial burden of healthcare costs much less expensive for yourself and your employer, while also improving your quality of life and reducing risk of chronic disease.
This leads us to our conclusion that making these necessary lifestyle changes are crucial to your health and your quality of life. Finding opportunities in your local community can provide assistance with learning more about hypertension, cholesterol, prediabetes, diabetes, and reducing the risk of cancer reoccurrence. For more information about programs we offer, including our diabetes prevention program called Prevent T2, hypertension workshops, or active living after cancer, please email us or give us a call. We can't wait to hear from you. We look forward to helping you take your next step on this journey to a healthier lifestyle.